Most people think sugar hurts the waist first. They think of belly fat. They think of cravings. They think of high blood sugar. But one of the scariest places sugar may hurt is the brain. That is why some researchers started using a shocking name. They called Alzheimer's disease type 3 diabetes. Not because Alzheimer's is exactly the same as diabetes, and not because every doctor uses that name. They do not. But they use that phrase for one big reason. The brain can become resistant to insulin too. And when that happens, memory, learning, and brain cell survival can start to break down. That is the terrifying link. To understand it, we need to start with one simple fact. Insulin is not just about blood sugar. Most people think insulin only matters in the body. They think it moves sugar out of the blood and into muscles and fat. That is true, but insulin matters in the brain too. Your brain uses insulin as a signal. It helps brain cells handle fuel. It helps with memory. It helps with learning. It helps support the health of key brain areas. One of those areas is the hippocampus. That is the part of the brain that helps form new memories. So when insulin signaling in the brain stops working well, the problem is not small. It can affect how the brain gets energy. It can affect how brain cells talk to each other. It can affect how well memories form and stay. That is why brain insulin resistance gets so much attention in Alzheimer's research. And this is where sugar enters the story. If you eat a high-sugar diet for years, your body can move toward insulin resistance. That means your cells stop listening well to insulin. The pancreas makes more. The body stays under more strain. And over time, this problem may not stay only in the body. It may also reach the brain. Some reviews now describe Alzheimer's as being closely tied to brain insulin resistance. That is the reason for the phrase type 3 diabetes. Again, it is not the official name of Alzheimer's, but it is a warning label. It tells you that bad sugar handling and bad insulin signaling may play a big role in how the brain gets damaged. Now think about what that means. Your brain needs a steady fuel supply. It needs clear signals. It needs low inflammation. It needs healthy blood flow. Sugar overload can hurt all four. First, high sugar can help drive insulin resistance. Second, insulin resistance can change how the brain uses glucose. Third, high sugar can raise inflammation and oxidative stress. Fourth, it can damage blood vessels, and your brain depends on blood vessels every second. So the link is not just one pathway. It is many pathways stacking on top of each other. Too much sugar can change the body. The changed body can change the brain. And the changed brain can slowly lose its grip on memory. This is not just theory. Researchers have been writing about this for years. A major review called Alzheimer's disease is type 3 diabetes pulled together evidence that brain insulin resistance is strongly linked to Alzheimer's disease. Another major review in the Lancet Neurology explained that brain insulin resistance may be a real risk factor in Alzheimer's and related brain disorders. That is serious. It means this idea is not just a catchy phrase online. It comes from published research. Now let's make it simple. Why would bad insulin signaling hurt memory? Because brain cells are busy cells. They need energy all the time. They need to send signals fast. They need to build and protect connections. If insulin signaling gets weak, those cells may struggle more. Memory pathways may weaken. Learning may get worse. The brain may become more open to damage from inflammation and stress. This is one reason the hippocampus keeps coming up in this story. The hippocampus is one of the brain's key memory centers, and studies have linked insulin resistance with worse function in this area. That means the part of your brain that helps you remember names, places, and new facts may be one of the very places taking the hit. Now add blood sugar swings on top of that. High sugar meals can cause spikes, then crashes, then cravings. then more spikes. That unstable pattern is hard on the whole body. And it may be hard on the brain too. The brain likes stable fuel. It likes calm chemistry. It does not like wild swings, chronic inflammation, and damaged insulin signals. So even before memory loss becomes obvious, the groundwork may already be getting laid. That is what makes this topic so scary. The damage can build in silence, just like fatty liver, just like kidney stress, just like insulin resistance in the body. The brain can be changing long before a person ever hears the word dementia. And there is more. High sugar diets have also been tied to lower brain health in other ways. Reviews on diet and memory show that high-fat, high-sugar eating patterns can hurt learning and memory, especially in brain areas tied to the hippocampus. That does not mean one dessert erases your memory. It means the daily pattern matters. The brain responds to the life you build around it. And if that life keeps bringing high sugar, low fiber, low sleep, and constant metabolic stress, the brain may pay the price. There are also large human studies pointing in the same direction. In a big study with more than 200,000 people, researchers found that higher sugar intake and high sugar eating patterns were linked with a higher risk of dementia. That kind of study cannot prove that sugar alone causes Alzheimer's, but it adds to the warning signs. The pattern keeps showing up. More sugar, more metabolic trouble, more brain risk. And this makes sense when you look at the body as one connected system. Sugar overload can lead to insulin resistance. Insulin resistance can lead to higher insulin levels and worse blood sugar control. That can lead to more inflammation, more damage to blood vessels, more stress on the brain. And the brain is very sensitive. It is only about 2% of your body weight, but it uses a huge amount of your energy. So when energy signaling goes bad, the brain feels it fast. There is also the blood vessel side of the story. Your brain runs on blood flow. If blood vessels get damaged by years of high blood sugar, glycation, and inflammation, the brain can lose support. Less healthy blood flow means less oxygen and less fuel. That can make a bad situation worse. So, the sugar-Alzheimer's link is not only about insulin, it is also about blood vessels. It is also about inflammation. It is also about oxidative stress. It is also about long-term damage building layer by layer. This is why the phrase type 3 diabetes hit so hard. It gave people a simple way to understand a hidden idea. The same bad sugar biology that hurts the body may also hurt the brain. Not in the same exact way, but in a close enough way that researchers saw a major overlap. Now, to be clear, Alzheimer's is complex. Age matters. Genes matter. Sleep matters. Exercise matters. Blood pressure matters. Brain injury can matter. This is not a one-cause disease. So no honest person should say sugar is the only cause. It is not. But it may be one important part of the story, especially because it drives insulin resistance. And insulin resistance keeps showing up in Alzheimer's research again and again. That means sugar may not be the whole fire, but it may help feed it. And that alone should get your attention. Because sugar is not rare. It is everywhere. In drinks, in snacks, in breakfast foods, in sauces, in healthy foods, in foods people eat every day without thinking. That means a lot of people may be building brain risk without knowing it. Not because they are trying to hurt themselves, but because nobody explained the full map. They were told sugar affects weight, maybe teeth, maybe diabetes. They were not told that insulin matters in the brain too. They were not told memory centers may suffer when insulin signaling breaks down. They were not told some researchers were worried enough to use the phrase type 3 diabetes. That is the part people miss. Now here is the good news. This story is not only about damage, it is also about direction. If bad sugar control can move the brain one way, better sugar control may help move it the other way. Better diet, better sleep, more movement, less sugar overload, less insulin resistance, less inflammation. These changes may not erase disease, but they can change the ground the disease grows in. That matters, because the brain is not separate from the body. A healthier body helps support a healthier brain. That is one of the biggest lessons in this whole topic. You do not protect your brain only with crossword puzzles. You also protect it with metabolism, with blood sugar control, with sleep, with exercise, with less daily chaos in the system. So what is the terrifying link between sugar and Alzheimer's? It is this. Sugar can help drive insulin resistance. Insulin resistance can reach the brain, and when the brain stops responding well to insulin, memory and brain health can start to fall apart. That is why some researchers call Alzheimer's type 3 diabetes, not because the names are the same, but because the damage overlaps in a scary way. The brain loses good insulin signaling. The brain loses energy control. The brain grows more vulnerable, and over time, that may help push it toward decline. So the next time someone tells you sugar is only a body issue, remember this. Your brain listens to sugar too. Your memory listens to sugar too. Your future may listen to sugar too. And once you understand that, sugar stops looking like a small habit. It starts looking like a long-term signal. A signal that does not stop at the waist. A signal that may reach all the way into the mind.